Prediabetes is a condition in which a person's blood sugar levels are higher than normal, but not high enough to be diagnosed as diabetes. It's a warning sign that a person is more likely to develop type 2 diabetes. About 88 million Americans, or more than 1 in 3, have it. But most people are not even aware of it. Some risk factors, like genetics, are beyond our control. However, changing one's lifestyle is crucial for correcting prediabetes and preventing type 2 diabetes. So how can you reverse prediabetes? Get ready to learn about some easy lifestyle hacks to help reverse prediabetes naturally. As always, you'll get a bonus towards the end of this video, and today's will be something that can help you in this battle, and it's completely free. Make sure to stick to the end, as this unexpected hack will shock you. Welcome to Wellness Wonders. On this channel, we'll talk about getting healthy, utilizing both conventional Western medicine and the more holistic and integrative approaches advocated by Eastern medicine tenets. Without further ado, let's get to it. Let's start with an easy one. Eat a clean diet. One risk factor for prediabetes is a diet rich in processed foods with extra unhealthy fats, calories, and sugar, and without any nutritional benefit. Your risk is also increased by a diet heavy on raw meat. A clean diet, which includes better options, can aid in reestablishing normal blood sugar levels. This can help prevent type 2 diabetes and even reverse prediabetes. Be sure to include items low in calories and fat in your diet, including fruit, complex carbs, vegetables, lean meats, whole grains, and healthy fats, like fish and avocado. An easy addition to your diet? Raspberries. According to a new research study published by the Journal of Obesity, sweet, juicy red raspberries do more than flavor your morning smoothie or a bowl of oatmeal. Pre-diabetic participants in this study, who consumed at least a single cup of red raspberries with breakfast, experienced better glycemic controls over the next 2 hours. The researchers attributed this improvement to increased insulin sensitivity. Next up, reduce your weight. Regular exercise is a healthy habit that can help people lose extra weight, which can positively affect their health. A mere 5 to 10% reduction in body fat can improve blood sugar control and correct prediabetes. This might translate for some people into dropping 10 to 20 pounds. Adopting healthy eating practices and regular exercise in one's routine is crucial for weight loss. There are different actions that people can do, such as joining a gym, working with a personal trainer, or getting a friend or a family member to act as their accountability partner. In addition, spreading out your meals throughout the day, rather than having 3 big meals, may be beneficial to some people. It is possible to lose a lot of weight and keep it off, with persistence and a mix of these tactics. Another thing to consider: avoid alcohol. To lower the chances of developing type 2 diabetes, the American Diabetes Association, EDA, advises those with prediabetes who drink alcohol to do so in moderation. Moderate alcohol consumption is 1 drink for women and no more than 2 for men daily, although this recommendation is based purely on weight. Wine serving is 5 ounces, beer 12, and liquor measures 1.5 ounces. People with prediabetes who drink more alcohol than is advised have an increased chance of developing type 2 diabetes, so it's essential to abide by these guidelines. It's vital to remember that even while moderate alcohol drinking may have some possible health benefits, it's crucial to consider each person's unique situation and get the advice of a healthcare professional before beginning. The potential dangers and advantages of alcohol intake can be influenced by age, health state, and prescription medication use. Next hack: reduce stress. Research has demonstrated that emotional stress is an integral part of developing type 2 diabetes. Cortisol, also known as the fight or flight hormone, is one of the sympathetic hormones released in response to stress. These hormones can progressively promote insulin resistance, which might result in high blood sugar levels over time. While a little bit of stress from time to time is standard and may even be beneficial, persistent stress can have significant adverse effects, including a higher risk of type 2 diabetes. Therefore, everyone has to practice stress management techniques to lessen the impact of stress on their general health and well-being. People can include several efficient stress management practices in their daily activities. For instance, stress can be reduced via favorite exercise, mindfulness meditation, self-care routines, creative endeavors, and spending quality time in nature. Engaging in these activities can improve emotional health, lower cortisol levels, and ultimately reduce risk of type 2 diabetes. Next up, start working out. Exercise is one of the most critical tactics for avoiding type 2 diabetes in patients with prediabetes. Numerous recent studies have shown that it improves your body fat composition, A1C levels, maximum oxygen uptake, blood sugar, and glucose tolerance, in addition to assisting you in maintaining your weight. Before we move on to how to start exercising, if you're enjoying this video so far, please hit that like button and subscribe for more content about self-development and mental health. It helps our smaller channel grow, and kindness will go a long way. So how can you start exercising if you've never done it before? Start small. Even a short stroll might have a significant impact. According to research published in the World Journal of Diabetes, daily walking for at least 30 minutes can cut your risk of type 2 diabetes by about 50%. Another trick? Don't sit still. You may set a timer or alarm to prompt you to get up and move about every half an hour if your job requires you to sit at a desk all day. Get out of your parked car, stretch, and think about taking the longer route or the stairs rather than the elevator. If your company requires you to be seated all day, consider using a standing desk. You can also consider making your idle time productive. For example, you can watch your favorite TV show while you step in place or lift light weights. The next important step to reduce prediabetes: stop smoking. It is well known that smoking raises the risk of lung cancer and heart disease. The risk of insulin resistance, prediabetes, and type 2 diabetes is also increased by smoking. The actual risk is 30 to 40% higher in smokers than in non-smokers. Additionally, heavy smokers are in significantly more significant danger. And don't forget that smoking makes managing diabetes more difficult. Peripheral neuropathy, or nerve damage in the nerves of the limbs, kidney disease, heart disease, and other significant problems, are more likely to affect people with diabetes. You can get support to stop smoking from your doctor or even insurance provider. Use over-the-counter medications like nicotine gum or patches. Ask your doctor about prescription drugs that can help you quit smoking or programs that can help you quit. Next up, deal with sleep apnea. Remember that sleep apnea and insulin resistance have been linked. In sleep apnea, respiration frequently ceases throughout the night. The signs of sleep apnea include a loud snore, gasping for air as you sleep, choking, waking up with a headache, daytime drowsiness. Using a respiratory device to support the airway during sleep is a common therapeutic strategy. A CPAP machine contains positive airway pressure at night. The upper airway path is, therefore, more accessible while you sleep. If you're unsure whether or not you might have sleep apnea, ask your doctor about getting tested. It's an easy fix that can go a long way in your fight against diabetes. Another trick? Eat dinner early. Intermittent fasting is a popular time-restrictive eating plan, which involves limiting your meal intake to a particular time of day. Additionally, there is evidence that intermittent fasting may be advantageous if you have prediabetes. In a study on males with prediabetes published in Cell Metabolism, subjects were advised to restrict their meal consumption to a 6-hour window or to a control group who ate within a 12-hour window for 5 weeks. Even though they didn't lose weight, the intermittent fasting group participants observed improved blood pressure, beta cell activity, insulin sensitivity, and evening appetite. You can also start working with a nutritionist. The ADA advises pre-diabetic individuals to join a lifestyle program or consult with a licensed dietitian or nutritionist. By adopting dietary modifications, medical nutrition treatment can assist someone in lowering their blood sugar levels and achieving other objectives like decreasing weight or lowering their blood pressure. While giving dietary advice, the dietitian considers the client's cultural traditions and culinary preferences. CDC-approved programs for altering one's lifestyle provide pre-diabetic patients with assistance from trusted sources. The program helps people who are at least 18 years old, overweight according to their body mass index, not pregnant, and have not been given a type 1 or type 2 diabetes diagnosis. In order to be eligible for this program, participants must satisfy the following conditions: have recently had a blood test with prediabetes-related results, based on a risk assessment, have a high risk of developing type 2 diabetes, or have experienced gestational diabetes. Another government program is the Medicare Diabetes Prevention Program, and it's open to everyone over the age of 65. To be eligible, one must have recently obtained blood test results demonstrating they are in the prediabetes range. Now, before we round off this session, as I hinted at the start of the video, I'll share an unexpected hack for prediabetes. It's staying hydrated Water is the best beverage choice for pre-diabetics because it has no sugar. Water consumption also aids in blood sugar regulation, since the body eventually converts the sugar into urine, leading to frequent toilet visits. This might cause dehydration. Dehydration can cause a decline in blood volume and an increase in blood sugar concentration. Just avoid this by drinking water, which helps you maintain healthy blood sugar levels. You're in good shape if the color of your pee is a light yellow. Drink more if it's darker. Just be sure to stick to water and avoid sweetened beverages. And that's it for today. If you found this video helpful, please like and comment below so we can continue our conversation about this important topic. And don't forget to subscribe for more content like this. See you soon.